Acute pulmonary edema, abnormal accumulation of fluid in the lung, either in the interstitial space or in the alveoli. Heart failure as a cause is a significant cause, and hypertension also. Heart failure leads to decreased cardiac output, accumulation of uh, blood in the left ventricle leading to increase in the pressure on the left side of the heart, so that increasing pressure in the pulmonary vein leading to infiltration, which is the passage of fluid and electrolyte to the interstitial space, causing pulmonary edema. Also, hypertension play a significant role in developing pulmonary edema. Clinical manifestation: restlessness, confusion, difficulty breathing, sense of suffocation, rapid weak pulse, distended neck vein, cold hands, nose, nail bed, gray skin, cough, and decreased O2 saturation. Medical management: improve the ventricular function, improve the cardiac ability to eject enough amount of the blood, so that decreasing the left side pressure, and improving the blood oxygenation toward the lung using autotherapy, medication, and nursing support. Intubation and putting the patient on mechanical ventilator may be needed in severe heart failure. Providing a positive end expiratory pressure that promotes alveolar expansion and prevent alveolar collapse. This is one of the strategies that is used in mechanical ventilator. Oximetry to measure O2 saturation, performing ABGs, which is arterial blood gases measurement to measure the level of O2 and CO2 in the arterial blood, indicating also the level of pH, giving morphine 2 to 5 milligram to reduce anxiety and provide a vasodilator effect on the lung, diuretics to secrete sodium and water and decreasing the load on the lung and correct the underlying cause like heart failure. Once the heart failure is corrected, the pulmonary edema is relieved if the cause heart failure. Also, we can give medication to increase the myocardial contractility, improving cardiac output like digital. Provide a good position to patients to promote circulation, psychological support, and monitor medication in terms of dosage, side effects, and administration. The last topic in cardiac system is the cardiac failure or the congestive heart failure. Its inability of the heart to pump sufficient amount to meet the metabolic needs for tissues in terms of oxygen and nutrients. There are different causes: myocardial infarction, hypertension, valvular diseases. We can classify heart failure either to systolic heart failure, weak heart muscle, damage in the cardiac muscle that lead to decreased contraction, so that call it systolic heart failure. Diastolic heart failure, difficult of the ventricle to fill with the blood, so that difficulty or decreased amount of the blood filled from the atrium to ventricle. Manifestation: inadequate tissue perfusion lead to dizziness, confusion, fatigue, cold extremities. Exercise and heat intolerance، ما بيقدر يتحمل البرد ولا التمارين الرياضية، ما there's no enough oxygen. Decreased cardiac output leads to decreased perfusion to body parts like kidneys, so that result in decreased urine output. In addition, right side failure may lead to high venous pressure. Left side failure may lead to pulmonary edema. Right side failure, peripheral edema, weight gain, and distended jugular vein and cough.